Hello, I am Ortiz, one of the nurses in the ICU. This presentation is geared towards the patients and families of patients that will undergo scoliosis repair surgery. And the goal of this presentation is to reduce the anxiety and provide patients and families with information on the flow of care after surgery. The ICU is fully staffed with specialized personnel such as doctors, critical care nurses, physical therapists, occupational therapists, and others that are trained to take care of the scoliosis patient after surgery. The care right after surgery will require you to be in an ICU room, and therefore you will be hooked up to several monitors, cables that are monitoring your blood pressure, heart rate, and other vital signs that are very important after the post-op period. You might also have a ventilator, which is a tube that might help you breathe for a few hours until you wake up or the anesthesia wears off. And when the doctor feels it's time, that will come up. One of the key components to the care of the scoliosis patient is pain management, which is very challenging. There are several ways that we address that, such as PCA, which means patient-controlled anesthesia, in which you are in control of your pain medication by pushing a button. You also get oral medications once you're able to take oral. You can have patches on your skin to control the pain. We can reposition you, and many other techniques that we can use. The point being that pain will be part of the experience, but we will keep you comfortable against measuring the way you're breathing versus pain control. So it's a fine line that the nurses have to deal with, and that they will work with you. The first day after the ICU recovery, you will be out of bed by a physical therapist. The physical therapy is essential in your recovery because they monitor the level of your strength, how well you are progressing as far as muscles, ligaments, and all of that, so that they can adjust their treatment individually to your needs. You might have a brace or you might not, but it's very individualized to your curvature or your need. After the ICU, in 1 or 2 days, you'll go to the progressive care unit. In this unit, you will be taken care of in a more aggressive way as far as the physical therapy, because we are preparing you to go home. They will determine if it's necessary for you to go home or to a rehabilitation center, depending on your progress. And this is done by the assistance of case managers and social workers. To summarize this presentation, you should be able to identify 3 ways that we address pain management, like patient-controlled anesthesia, oral medications, or additional IV boosters of medications, and skin medications as well, and also to list 2 of the most important points about this surgery, which is physical therapy, activity, mobility, and pain management. I have been a nurse doing this for several years, but there's no better way to relate this than I have Kathy, one of our Nightingale nurses over here. Let me explain to you what a Nightingale nurse is. Is one of the nurses, retired registered nurses here at the hospital, that orients patients to the care of post-op after surgery. And not only does she do that, but Kathy also went through these surgeries, so I can talk all I want, but nobody can say it better than somebody that went through it. So Kathy, would you please tell us your story? Like how did the pain begin, and what was your experience?
Certainly. My situation was just a little bit unique in that whereas most people have had scoliosis for a good long time and the pain has progressed gradually until it gets so bad they can't stand it anymore, mine hit quite suddenly. I did not have scoliosis as a child. No one in my family had it. Mine hit me suddenly, and I just felt a new pain on my right side, and I wondered what that was about. So I went to my orthopedist, and he took a full standing back x-ray, and he showed me on the screen. He said, well, there it is. There's your scoliosis. And what's that? I mean, adults have scoliosis? And he pointed it out. My spine looked like an upside down question mark. My ribs were, I was tilted to the right, and my ribs were rubbing on my hip bone. and that was the cause of the excruciating pain. So I was quite surprised that I had adult scoliosis because I've never had it before.
Do you recall any of your experience in the ICU or your care in the hospital?
Bits and pieces. Certainly in ICU, pain was a big issue, but for me, I was so gratified that when I first opened my eyes in ICU, I was aware that that pain that I had before the surgery was gone. And yes, I had surgical pain, but knowing that that was going to get better, I could tolerate that. And with the guidance and the help of the staff there, who certainly are more attuned than I, but how to control it, things went quite well, and I made good progress.
Good. And through your experiences when you visit patients after they have had this surgery, what are the key points that you can relate to patients that are going to go through this surgery?
Well, the main thing is, yeah, you're going to be frightened and nervous about the surgery, but try to remember where it's going to take you, that it's going to improve the quality of your life. It's certainly improved my quality of life. Mine went from a life managed and dominated by pain to where I'm basically pain-free right now, and I do pretty much whatever I want. I'm back playing golf, I work out 2 to 3 times a week without pain, and that's the key answer. So even though it is a daunting looking experience, try to remember where it's going to take you after the surgery. And be prepared. Yes, you'll have pain, intense pain for a short period of time, then it will start getting better.
Well, thank you, Kathy, for telling us your story, because I don't think, even though I take care of these patients, I could convey what you go through unless you have gone through this like you have, so I appreciate your telling us your story. Thank you very much.